Hello, this presentation will be explaining the mobile app MediBabble, a free mobile medical translation application available in Apple's iTunes Store. Presenter is Lauren McCabe, RN, a student at St. Petersburg College RN to BSN program. MediBabble is a professional translation application that is geared towards professionals working in the healthcare setting. It is preloaded with different selections of medical questions that are then played in the patient's language for them to listen to and answer. MediBabble comes pre-downloaded with Spanish as the translated language. However, the user is able to download 6 different languages to use for free. These languages include Chinese Cantonese, Chinese Mandarin, French, German, Haitian Creole, and Russian. According to their website, there are 3 other languages that are in the process of being added, including Japanese, Arabic, and Farsi. Using MediBabble, a medical professional is able to quickly gain pertinent medical information in order to appropriately treat the patient. The questions are stated in a way that the patient only needs to answer yes or no, or by holding up fingers to denote an amount. An example of this is regarding medication. How many pills do you take at a time? The question categories are separated in a way to be able to navigate through them easily by the type of question when assessing a patient. When the user first opens the app, the question categories are all listed on the main page, making navigating through them easy. The user can then click on the category and is brought to a list of questions. When a question is picked, the question is read aloud in the language chosen. The language is easy to change as well. By simply clicking the black language band at the bottom, the list of alternative languages is brought up that are available for selection. The question categories include introduction and explanation, chief complaint, history of present illness, past medical history, medications and allergies, family and social history, review of systems. These questions are meant to be used during an assessment. An example of these questions is, have you noticed a change in the color of your urine? Physical exam, which is also meant to be used during an assessment. An example is, please take some deep breaths in and out through an open mouth when you're listening to a patient's lung sounds. And follow-up questions. When a category is selected, the user is brought to another screen with subcategories of that question. For example, when assessing a patient's family and social history, the family and social history category is selected. This opens up a new screen of 5 subcategories, including family history, health-related behaviors, social history, ADL, and IADLs. When a subcategory is chosen, it brings up a list of questions related to that subcategory. For instance, let's say a nurse wants to know if the patient smokes cigarettes. The nurse opens the application, selects the family and social history category, then clicks the health-related behavior band, and is faced with 6 questions pertaining to tobacco use, alcohol withdrawal, caffeine use, recreational drug use, and sexual history. There's the band titled Tobacco Use. When the blue play button is selected, it plays the question, do you smoke cigarettes? If the patient answers yes, there are follow-up questions listed below that are able to be played to the patient to accurately gain more information regarding the patient's tobacco use, including how many years have you smoked for, and about how many cigarettes per day do you smoke. The questions are conveniently categorized and accessible to the medical professional using the application. In the example given, it took 4 clicks to get to the specific category of question needed to ask the patient. Since the questions are formatted in yes or no answer form, the patient is not able to elaborate on any answers they give. For example, when assessing a patient for chest pain, there are many questions that are specific to try and accurately have the patient describe the pain. When asking the patient how long ago the pain started, there are 4 selections to choose from, including more than 12 hours, more than 3 hours, more than half an hour, or less than 20 minutes. These are good at getting a more concise idea of when the pain started. However, the patient is not able to expand on the information. For instance, if it happened first yesterday at noon, and then started again 45 minutes ago. Also, there is a limited selection of languages to choose from. If the nurse receives a patient who speaks Korean, the application would not be able to be used as it does not offer that language, and an alternative method of translation would need to be used to assess the patient. Looking at the application from a legal standpoint, it does have some pitfalls in the area of giving consent for procedures and patient education. Legally, before a patient can have an invasive procedure, the patient must sign a consent form stating that they understand what procedure they're having, the risks and benefits of the procedure, recovery period, and alternative treatments. Using MediBabble, this would not be able to be translated to the patient, and alternative methods of translation would have to be used. MediBabble focuses mainly on med-surg or ER nursing with the focus on assessment. However, according to their website, they are in the process of expanding their content to include different specific areas such as surgery, pediatrics, and trauma. Also, there is not an area to do any type of patient education regarding diagnosis, treatments, or hospital stay. Education is a crucial component of patient care, and since MediBabble doesn't address this, it would require an outside translator to fill in a situation like this to make sure the patient is properly educated. Overall, MediBabble can be a useful tool to nurses and other healthcare providers in helping to thoroughly assess a patient. The categories and subcategories are organized in a way that flows smoothly throughout the assessment process. While it can be a vital tool in the assessment of a patient, it does have major holes regarding total patient care. It does not have any way for the patient to elaborate on any questions answered. It focuses mainly on med-surg assessment with specialty areas not included, and does not provide translations related to ADL care, such as asking if the patient has to use the bathroom, if they would like help getting cleaned up, or if they would like to go for a walk. While there are questions asking about the patient's walking abilities, such as if they are able to sit up, stand up, or walk by themselves, it does not have anything asking if they would like to go for a walk. This is crucial because patients need to be involved in their care while they're at the hospital. Also, it does not have a way to translate what the patient is saying to the nurse, so if the patient has questions or requests, it would still require an outside translator. MediBabble is a great tool that I would recommend for assessing a patient, however, it falls short in providing translation for overall care. In conclusion, MediBabble is a free app that is available for download in the iTunes App Store. It is set up in a way that it is easy to navigate while assessing a patient and has many different types of categories and questions. When using it, it only takes a few clicks to get to the category needed, and it is set up in a clear and easy to use way. While it is a great tool when assessing a patient, it does have some major pitfalls when it is analyzed regarding total patient care, as it does not provide any way for the patient to translate what they want to say to the nurse. The questions are set up in a yes or no answer form, which is beneficial to quickly obtaining crucial patient information. However, because of this, there is no way for the patient to elaborate any further than yes or no when answering questions. It is currently available in 6 languages on the app, and there are 3 more in the works. However, there are hundreds of languages spoken in the world, so this is a very small percentage of languages in comparison.